You know that routine dental checkup we all go through? Well, what if that simple visit could become a frontline defense against oral cancer? It's all thanks to artificial intelligence. Today, we're diving into a really cool development that's giving dentists an AI-powered second set of eyes.
So, let me ask you this. Can a single photo taken at the dentist's office actually help detect cancer? I know, it sounds a little like science fiction, doesn't it? But the truth is, this is quickly becoming science fact. And believe me, it's about to transform oral medicine.
So how in the world does this work? Well, there's a powerful AI, a specific model called Inception ResNet V2, that can analyze a standard clinical photo. It's looking for something called oral potentially malignant disorders, or OPMDS for short. Now, simply put, these are spots or lesions in your mouth that aren't cancer yet, but they have the potential to become cancerous later. So you can think of this AI as a highly specialized assistant trained to spot these tiny, subtle warning signs.
Okay, but let's be real, not all AI is created equal, right? So what makes this particular model so good at this job? Let's take a look at the promise it shows when it's working under perfect, ideal lab conditions.
This AI really shines for a few key reasons. For one, it performs what's called multi-scale pattern recognition. That's a fancy way of saying it sees things the human eye can easily miss. I mean, it analyzes tiny changes in the mouth's lining at different scales, all at the same time. And because these problem areas are rarely uniform, this gives it a much more complete picture. So when you feed it clean, perfect images in a lab setting, the result is incredibly high accuracy. It's pretty amazing.
But that's the lab. And what works perfectly in a controlled, sterile setting often runs into some major hurdles in a busy, real-world dental clinic. So, it's time for a clinical reality check.
You know, the gap between the lab and the clinic, it's huge. Lab photos are perfect. They're clean, standardized, taken under controlled lighting. But in a real clinic, you get totally unpredictable photos. They're coming from different phones with all sorts of weird lighting, and you've got reflections from saliva messing things up. And AI that's only ever seen perfect data is naturally gonna struggle with all this real-world messiness.
And this brings us to some key limitations we have to consider. First, if the AI is trained on a small, very specific group of people, it might not work so well for everybody else. Second, it gets really confused by mimics. These are harmless things, like a callus you get from biting your cheek, that can look a whole lot like a real problem. And this gets us to the core issue with AI in medicine. It has this superhuman ability to recognize patterns, but it has absolutely zero human context. The AI gives you a probability score, but it can't understand a patient's habits, their symptoms, or their overall risk. It has all the data, but it's missing a doctor's intuition.
So if the AI isn't this perfect, all-knowing diagnostic machine on its own, then what's its proper role? Well, this is where we have to shift our thinking from replacing doctors to supporting them. The goal here isn't for an AI to become the doctor, it's to make the doctor even better at their job.
The single most valuable role for this technology right now is something called clinical triage. Triage is really just a simple process of sorting and prioritizing patients based on how urgent their situation is. The AI acts as this incredibly efficient first filter, helping clinicians decide which cases need their immediate attention.
So what does this actually look like in practice? It means the AI can sift through a mountain of images and flag the ones that are highest risk, pushing them to the top of the pile for review. It helps spot those subtle abnormalities a really busy dentist might otherwise overlook. For a high-volume dental practice, this is an invaluable support system. And in regions with more oral cancer cases, it can speed up the referral process in a huge way.
And that brings us to the final and, I think, most crucial point. The future isn't about choosing between human expertise and machine intelligence. No way. It's about uniting them.
The big takeaway here is this idea of a hybrid workflow. The AI performs that initial, super fast screening. It takes the first look. It does all the heavy lifting of sorting through the data. But it's always the clinician, with all their experience and judgment, who makes the final call. You really get the best of both worlds.
Look, the technology itself is an incredibly powerful tool, but the real, life-saving impact, that comes from skilled professionals who understand its amazing strengths, but also its critical limitations, and know exactly how to use it to help their patients.
So, we'll leave you with this final question to think about. With its potential to seriously boost our screening capabilities, should this kind of AI become a routine tool in every single dental practice?